So we are reading Hands of Light by Barbara Brennan. We are on chapter 16, page number 149 of the book and page number 166 of the PDF.
How healers and physicians can work together. With healers and physicians working together, it is possible to take advantage of the best technology and the best personal attention available for each patient. Let us see how it would work. Healers can assist physicians in the three ways mentioned in the introduction to this section. They are giving a broader view of the causative factors involved in any illness, providing information that cannot be obtained through the present standard methods or that cannot be obtained by those methods in the time required, and providing laying on of hands to balance the energy system of the patient and to enhance and accelerate the healing. Many times, this last effort helps the patient gain the strength necessary to save his life.
So what does it mean, right? The healer is looking with different kinds of perception, from a higher sense of perception, to look at what is happening with the patient, right? Now, when a doctor, a normal allopathic doctor is looking at a patient, they are dependent on reports. And many times the reports, the technology is not good enough to actually give a direction to as to what is happening with the patient. So the healer at times has a broader view, or has a broader spectrum to be able to test things. Yes, allopathy has its benefits with the technology. Intervention in emergencies is very important with allopathy. But long-term healing can only take place if the energy system of the patient is balanced, right? And that is better done with the natural healing processes which are there, or the so-called alternative sciences or healing processes which are in vogue. And those sciences actually give the strength, the resilience to a patient to actually start getting better. This is something that I'm seeing over and over again. And especially when we are doing biofield tuning, I have found that people who are in hospital and medication is not working, just by balancing the earth star and sun star, we find that the patient's body resilience and be able to use the medication being given to heal themselves starts to get enhanced. So again, laying of hands, backflower remedies, homeopathic medicine, you have this pranic healing, Reiki, all so many treatment systems are there which are available, which can be used by healers to enhance the healing process that the normal allopathic doctors are using.
In clinical practice, the healer can work directly with physician and patient in making the first diagnosis to pinpoint the problem, give an overall view of how the energy system is out of balance, and thus how serious the problem is, provide a broader view of the causative factors involved, and work with the patient on the meaning the illness has in his life.
So again, the healer is giving a broader perspective, and also anything that happens in our life happens for a reason. So the healer, because they are going into higher states of consciousness, can actually start to discern what is the lesson that the patient needs to learn. Many times an illness comes into our system just to teach us something. So that perspective of healing is also very, very important. Otherwise, you will find that relapse starts to take place. You've got well, then again, you will have the same thing. Certain chronic illnesses are due to not learning the life lesson. When we learn the life lesson, then the chronic things can get taken care of. Allopathy is not very competent in dealing with chronic things. They are very good with emergencies, with just in the point of treatment, but long-term effects and what is happening because of the past, they can't get to that very easily, because it is more energy driven rather than physical driven.
The healer's methods of diagnosis will be discussed in the next chapter. The healer can receive recommendations through use of eye sense perception about the kinds and amounts of specific drugs to be taken, supplementary healing techniques, diet, food supplements, and exercise. The healer can follow the case with the doctor and again, through the use of high sense perception, make recommendations as to how that dosage and other supplements need to be changed week to week, day to day, or even hour to hour. In this fashion, the healer and physician together can achieve a level of fine tuning in the care of the patient never before imagined. The healer can observe the patient's energy field to tell how the drug or other healing methods used are affecting the patient overall.
So again, it is actually possible to figure out the exact dosage which is required for a particular medication to be taken. What is the combination in which the medication will work the best, right? And we can do this using the Lecker antenna and the pendulum, the BG3 pendulum, which we can test with the energy field of the patient as to what is the combination works best, right? So you can have one drop of, let's say, belladonna and one drop of arsenic mixed together will give an effect, or taken separately will give a better effect. Which, like, you take a crocin will work better for you, or a Panadol will work better for you. We can actually test depending on the combination to see what will work better for the patient. So a healer operating from higher sense perceptions and other methods of testing which are not normally available to the allopathic doctors can actually fine tune the medication being taken.
I have done a little of this work and it has been very effective. I have met a healer, Metek Wirkus, who worked in this way for 3 years with physicians in a clinic affiliated with the Isaacs Medical Society in Warsaw, Poland, that was set up specifically to do this work. It was very successful and is still in operation. Records kept by this clinic show that laying on of hands called bioenergotherapy, BET, is most effective in nervous system diseases and the diseases which were consequences of migraine, inhaling, bronchial asthma, nocturnal neurosis, hemicrania, nervous illness, psychosomatic diseases, gastric ulcer, some kinds of allergies, liquidation of ovarian cysts, benign tumor, sterility, arthritic pains, and other kinds of pain. BET helps to relieve the pain caused by cancer and decrease the amount of pain medication or tranquilizers taken by the patient.
So this is very important, right? If we can manage the pain in most cases, a lot of relief can be given to the patient, right? And also, laying of hands works at the energetic level. And the previous chapters we saw that the problem starts at the external auric layers, and the laying of hands works on the external auric layers, whereas allopathy is working only on the physical body, right? So when you combine the two, again, it becomes very effective.
Good effect has also been observed in treatment of deaf children. In almost every case, the doctors discovered that after BET treatment, patients became more quiet and relaxed. Pain was gone or relieved, and the rehabilitation process, especially after surgery or infection, was accelerated.
So again, this is something that we've seen with hemisync also. When people are going into surgery, there is a surgery support series which is there. When they use that track before going into surgery, during the surgery, and after the surgery, the healing process definitely gets accelerated, right? So again, using alternate means to accelerate the healing and manage the pain. And we have seen with the healing support series, we've seen that the pain medication required by the patient definitely at least halves, if not goes down to 1/3 of what is required.
In almost every case, the doctors discovered that after BET treatment, patients became more quiet and relaxed. Pain was gone or relieved, and the rehabilitation process, especially after surgery or infection, was accelerated. In this country, many healers are beginning to work with physicians. Dr. Dolores Krieger introduced laying on of hands to the nurses at New York Medical Center years ago, and they practice it in the hospital. Rosalind Breyer, director of the Healing Light Center in Glendale, California, has entry to many hospitals to practice healing and is involved with several research projects to determine the effectiveness of laying on of hands for various types of illness. Another type of research would be through the use of high sense perception to help researchers find the causes and cures of illnesses that now seem incurable, such as cancer. With internal vision, which is discussed in the next chapter, the healer can observe the disease process at work inside the body. What a wonderful tool to assist research. With the use of high sense perception, the healer can tell which of the many holistic healing methods will work best for each patient by observing its effect on the aura.
So this is very important, right? We use the Lecker antenna to actually test the access of the person, whether something will work for the person or not. And this is something that I used a lot in BTD when we were working with the with children with dyslexia. We used to actually test which track will work best for the student. And we saw tremendous effects in the way that the students were learning, their pickup capacity, the mistakes they were making, etc. So if it can work with dyslexic children, there's no reason why it would not work with any other kind of patient.
By recommending that the patient focus on the most effective methods for him, healing will be accelerated. For example, in my observations, I have noted that different methods or remedies work on different levels of the auric field. Aubrey Wesley, in his book, The Pattern of Health, has designated which of the Bach flower remedies heal which auric levels.
So this becomes important, right? Each of the remedies is operating at a particular frequency, right? So what is the frequency that you're operating at will determine which layer of the aura you're working with. Like if it's an emotional problem, then it has to work with the auric field or auric level of the emotional issue. If you're working with a mental issue, it has to be done at the mental issue. If it's a spiritual issue, then it has to be done at the higher levels of the aura, right? So if I keep giving this example, if you are, let's say you have a stomach problem. Now the stomach problem can be a physical problem. That means there's an ulcer or a hole in the stomach. It could be a vital problem or a functional problem. The acids are not getting secreted at the right time. It could be a mental problem because of mental stress. You're having a stomach issue. And it could be an outside problem or an energetic imbalance problem or a spiritual problem which is causing the imbalance. Now, if I'm going to treat something which is being caused by an external problem with as if it's a physical issue, it will never get healed. Yes, it will subside and then it will flare back. So I have to treat it at a spiritual level. So like that, every issue needs to be treated at the level at which it is vibrating or resonating with.
By recommending that the patient focus on the most effective methods for him, healing will be accelerated. For example, in my observations, I have noted that different methods or remedies work on different levels of the auric field. Aubrey Westlake, in his book, The Pattern of Health, has designated Which of the Bach flower remedies heal which auric levels? I have observed that the higher the potency of the homeopathic remedy, the higher the auric body it affects. The higher potencies have 1M work on the higher 4 levels of the auric field, and the lower potencies work on the lower auric levels. Because of the tremendous power of the higher potencies, young practitioners are always taught to start with the lower potencies, lower energy bodies first, and then work up into the higher bodies when the correct remedy is found. In the process of laying on of hands, many healers are able to choose which body to work on.
So again, when we are doing laying of hands, it's a matter of consciousness, right? What is your intent? So if I'm intending to work at each level, I can intend it and the work will go into that particular level, right? So laying of hands would work with the consciousness of the healer. So the consciousness, awareness of the healer becomes extremely important. Again, with Reiki, pranic healing, all these are like laying of hands.
The same holds true for self-healing meditation, where one can work on all of the bodies. Radionics is a method to distill the healing energies from
Sumita, you missed.
No.
Okay, sorry.
The same holds true for self-healing meditation, where one can work on all of the bodies. Radionics is a method to distill the healing energies from the UEF with the use of machines which generate rates or frequencies.
So this is basically how the life system works. Of course, the machine is out of order right now. But again, in the life system, you are generating a particular frequency, and every organ, every bone, every mineral, every pathogen has a frequency of vibration, right? So the system generates the frequency which will help or support the healing of the body vis-a-vis that particular pathogen or that radiation or whatever healing needs to take place. We've in the life system, we were able to identify the basic muscle, test for the muscle, and then repair a specific muscle of a person, which actually helped this guy. He came with a torn ligament, and the doctor had told him 3 months bed rest. Just by giving him the frequencies, I think once every 3 days, that fellow actually within a month's time ran the 100 meters and actually came first in the race, right? So the healing gets accelerated when we start using frequencies also.
Along with radiesthesia, radionics broadcasts energies through the UEF to patients located at considerable distances from the practitioners.
So again, it can be done at a distance, right? So we regularly used to do life system sessions at a distance. Of course, I'm doing a lot of biofield tuning sessions at a distance. So again, it's all based on conscious awareness. The UEF stands for Universal Energy Field. The universal energy field is everywhere. So we use that field to transmute and send the frequencies.
A blood sample or a piece of hair from the patient is generally used as an antenna. The radionics practitioner can use which auric layer to work with.
So again, a piece of hair, skin, nail, all resonates with the patient, right? So generally speaking, you can add or put that piece of hair, etc. So like a homeopathic medicine, right? You can treat the hair of a person with homeopathic medicine and the vibratory frequency will go to that person. So when we are doing biofield tuning, we keep the person in front of us in Zoom and then we do the healing, right? So that also works. If you can develop a very strong mental picture of the person that you're treating, then you can treat that person there also. This is something that we are seeing in our healing group also, people who are there on the healing group, where someone mentions something about someone else. So you can connect with a person via a person also, because the intent is there, right? When you set a correct intent, the healing can automatically go to the other person using the universal energy field.
Chiropractic certainly reaches up through the first three levels of the aura, as do herbs, vitamins, drugs, and surgery. Of course, laying on of hands, healing meditations, and healing with light, color, sound, and crystals all reach the upper layers of the auric field. Through research, we could learn more about how to use them for the best results.
So again, crystals also work, right? Herbs, crystals, homeopathic remedies, batch flower remedies. There are so many remedies that we can use. Holy water, right? Blessed water, and you consume that water. Again, it becomes good therapy. For example, you put a reball on your water. You taste your water before a reball. You taste the water after the reball. You'll see that there's a marked difference in the taste of the water, in the feel of the water, right? So again, when we are blessing the water, when we are charging something and then consuming it, automatically it becomes more therapeutic.
Many books have been written on these types of healing. For further reading, I suggest the following books: The Science of Homeopathy by George Vitulkas, MD, Dimensions of Radionics by David Tansley, MD, Chiropractic, A Modern Way to Health by Julius Dontenfas, MD, Traditional Acupuncture, The Law of the Five Elements by Diane M. Connelly, PhD. The medical profession in this country has focused primarily on the physical body and has become expert in this field, especially in specific organ and organ system diseases. Drugs and surgery are the major methods applied. One of the major problems in the use of drugs and surgery in healing is the tremendous side effects which they very often create.
So again, when you have a surgery, there's a cut in the physical body. But that cut is not only in the physical body, it goes into the auric bodies also. So when healing takes place, many times the physical cut has got healed, but the auric body cuts are not healed. So you'll keep leaking energy from those cuts. So they need to be repaired, which can be done by laying of hands or other methods, the alternate therapies, right? And naturally, drugs will leave a trace of the chemical in the physical body. So the body has to work hard in removing the traces of the drugs. Many times it cannot remove it, right? So it gets stuck in the body, and then again it causes problems later on. So the toxicity level of the body starts to rise up.
Drugs are prescribed from knowledge of the physical body's functioning, but they also contain energies in the higher realms, which then, of course, affect the higher bodies. The effects of these drugs on the higher bodies have not been studied directly when the drugs are tested for use. Rather, the effects of these higher energies are only seen when they are finally precipitated down into the physical body.
So what does that mean? The drugs, although they are healing something, they'll cause a stress in something else. Now, when they cause a stress in something else, it takes time for the physical manifestation to occur in the physical body. So you're taking a drug to heal something, but there are always side effects. So if you're having something for your ulcers, they will always give you something for removing, reducing, like many times when you have antibiotics, they'll give you antacids to take care of the side effect of the antibiotics. So most allopathic medicines, you'll find that they will give you something else to balance out the side effects. And now those drugs will also have side effects. So again, you're going into a snowballing thing. Whereas if you're going into alternate therapies, generally there is no side effect.
I have seen the after effect of drugs remaining in the aura for as many as 10 years after the drug was taken. For example, a drug that was once used to cure hepatitis was seen to be causing immune deficiencies 5 years later. A red dye placed in the spinal column for exploratory purposes was inhibiting the healing of spinal nerves 10 years later.
So these drugs can cause effects going years ahead.
Towards a holistic system of healing. I believe the holistic healing systems of the future will combine the tremendous body of the analyzed knowledge of the traditional medical profession with the synthesized knowledge of the higher body energy systems. The future holistic healing systems will diagnose and prescribe healing for all the energy bodies and the physical body simultaneously as needed by the patient and incorporate both the inner and the outer healing processes.
See, this is something that we are seeing in the Star Wars movies and, in the Star Trek movies where they have this scanner and they're just scanning and everything of the body comes out. So again, when you're looking with higher sense perception, basically what the healer is doing is scanning, right? That what is out of balance, what is out of whack, and how to systematically put it into place. So when you look at Star Trek, I remember when we were in our teens, right? That time Star Trek came out and they used to flip this phone and start communicating, etc. We used to think that it is magic, it is never going to be possible. But today everyone has a cell phone in their hand. So going forward, we are definitely going to have some equipment, maybe 50 years later, I don't know, right? That we will just scan everything and everything will be picture clear. And then the healing will also start taking place, right? Automatically. So that combination is definitely going to start happening at some point in time.
Medical doctors, chiropractors, homeopaths, healers, therapists, acupuncturists, etc., will all work together to aid the healing process. The patient will be seen as a soul on its journey back home to the true self, the God self, and disease will be seen as one of the ways to point the traveler in the right direction.
So again, every illness has a psychological meaning, right? A psychophysical effect that is there, which when we start understanding, automatically healing starts to get enhanced.
To do this, we need to use the analytic methods developed by the medical profession to delve into the mysteries of the higher body in order to gain a practical knowledge of their functioning and structure. We need joint research projects in which the higher body healing methods are tested along with current allopathic scientific medicine to see the combined effects. How do allopathic drugs and homeopathic remedies work together, which are in harmony with each other, supporting and enhancing a cure, which are inimical and should not be used together?
Okay, so again, some things will work well together, some things may not. So we need to have a higher sense perception to be able to actually perceive this.
Must concentrate on finding a detection method to observe the energy bodies. Since the etheric is of course the coarsest matter, is most like the physical body and is probably the easiest to detect, we should concentrate first on it. What a tremendous tool we would have if we could produce a picture of the grid structure of the etheric to show energy balances and imbalances. With this information and further study, we could then find more practical and efficient methods to rebalance the energies in the etheric. In the future, we would move on to discover methods to apply to the higher bodies.
So again, when we used to take aura pictures, right, many times we used to detect, okay, urinary issues, vision issues, throat issues, back problems. All these things used to come in the aura pictures. And we could tell the person that, see, if you've not already got it, this is coming. And if you use this kind of a cure, then it will not hamper your well-being, right? And many times it used to actually work. We used to take an aura picture first, and something used to come out. They used to apply the process that we are telling them. We used to take an aura picture after some time, and the clearing could be seen in the aura picture. So this is what she's talking about. We needed more sophisticated methods of actually testing and becoming very precise with what we are observing and what we are seeing.
Thus, we could heal the disorder before it is precipitated into the physical body as physical disease.
So if we have methods of checking out the aura itself, then before coming to the physical body, it comes in the auric field, right? If we can check that, then automatically the thing will not affect the physical body, which becomes maybe at a certain level more difficult to heal than healing something at the etheric level or in the auric field.
Most of all, I would seek to teach healthcare professionals, especially physicians, to perceive the fields so that they can also see the disease process in action inside the living body of the patient. Some physicians are already reaching out for help. They send their hardest cases to healers. Usually, they do it covertly. It is time to come out of the closet and work openly as teams.
So again, this is a big problem which is there. The allopathic doctors really, because in their educational system, when they are being educated as doctors, the concept of healing through laying of hands and other processes is not discussed at all, and it is actually debunked that it is not possible to happen. So naturally, integration does not take place. But if a doctor who becomes effective in laying of hands and these other energetic principles are incorporated into their practice, then their intuitive ability to be able to perceive what is the problem can get really enhanced, and they can really enhance the well-being of their patients. One such doctor I know very nicely is Dr. Brian Daly. He gave us many talks on how to do biofield imaging, etc. And he regularly uses his intuition to treat his doctors. In fact, they are working on these drops that they are creating. It is not homeopathic drops, but more vibratory enhanced drops, which are non-invasive. There is so little of the original matter that FDA could not even discover what was in that vial, right? So they had to enhance what they were putting into the vial just so that the detection instrumentation used by the FDA in the US would actually detect it. And they've been very successful in, they're doing clinical trials right now, but in treating pancreatic cancer and other such diseases, liver cirrhosis, etc. By just giving those drops 3 times a day, you need to just take 1 drop of that liquid. That's it. You don't need to do anything else. And healing is taking place, right? So he is one person who's really working with this principle that I know. Sorry. So start again.
With highly trained and qualified people able to see the inner processes of the body by simply looking. Imagine how far those people could carry medical research. Rather than placing the emphasis on observing animals in a laboratory, research could be focused on the actual patient and his personal needs. When one is able to access directly, read, the kind of treatment a patient needs, programs will be designed on a personal level for each individual's healing.
So this becomes important, right? Everyone is unique. Everyone has gone through a life process. Their requirements are unique. So if we can delve into what is required by each patient and actually test it in a non-invasive way, it becomes very effective and efficient. We had another speaker who had come in our 9:15 sessions, John Cotter. He has developed a system by just seeing the texture of the face, and in various areas of the face, he has been able to develop 85% accuracy in diagnosing what is happening with the patient without any test, just by looking at the patient, and then providing certain remedies to them And then the texture and the feel of the face, the coarseness, the roughness, etc., that seems to shift, which results in the healing of the patient. So there are so many ways, there are people who can look at the fingers and say stuff. There are people who can look at the toes and say stuff. People look at the head and say stuff, iris and say stuff. People look at the tongue and say stuff, looking at the face and telling about the person. So everything, again, we coming to the microcosm with the macrocosm and the microcosm. Everything that is there in the small, in the microcosm, is reflected in the macrocosm. So if we can take a broad shot about what is happening with the patient, automatically healing will get accelerated, because the treatment will be patient specific, not just a blanket treatment which will be given to everyone.
Aeon has stated that the precise substance given in the precise dosage at the precise time for each individual acts as a transmutive substance to create health in the most efficient way, with the least side effects, and in the shortest time possible. Health here is not just physical health, it is complete balance at all levels.
Right. So health is, of course, what very clearly she's saying, is not only at the physical level, it's at the mental, emotional, and spiritual levels that you need to be aligned. If one is in sync, right? So you have very, robust and healthy kind of, let's say, bodybuilders, etc. But mentally and emotionally, they're total wrecks, right? So when is health there? When all the things are in synchronized and in balance, right? Now, whenever any kind of drug that is produced, it is a copy of the drug that is generated by the body to heal itself. Now, when the body is producing a drug, it produces it at the time, in the precise quantity, and at the correct place. But when we are taking drugs externally, that precision is not being maintained when we are taking allopathic medicine, right? So by using higher sense perception, it is possible to monitor the time, the quantity, and the place where the drug should be applied. That makes it much more efficient for healing to take place.
Given such a potential, let us now look at the many different ways of securing information on all levels of the aura. Okay.
Move ahead.
Chapter 17, Direct Access of Information. Accessing information beyond the normal means can help a healing enormously. It is possible to get almost any kind of information one needs through this method. Direct access means just what it implies. You directly connect with and receive the information that you wish to have. This process has been labeled high sense perception, clairaudience, clairvoyance, clairsentience, or psychic reading. Let us take a clearer look at just what that process is.
So again, using higher sense perception, using our like you see what happens is that we can see the electromagnetic spectrum is like this, but what we can perceive is only so much. So by using the clair senses, we are expanding that range of what we are able to perceive.
The information coming to you comes through your five senses. These have been labeled traditionally as sight, touch, taste, hearing, and smell. Most people have developed some of these means to access information more than others. Your internal processes of thinking, feeling, and being have a great deal to do with your modes of accessing information, as the neuro-linguistic programmers Richard Bandler and John Grinder have stated in their book, Frogs to Princes. Your internal experience runs through certain habitual channels. You may work primarily with a combination of visual and kinesthetic processes, or auditory and kinesthetic, or visual and auditory. Any combination is possible. You use different combinations for different internal processes. You may know whether or not you think primarily in pictures, sounds, or feelings. I recommend that you find out because the way you access through the normal senses is the way that I would recommend that you begin learning to develop your high sense perception.
So again, even in the workshops, we keep talking about pay attention to what you're experiencing, right? So some people are kinesthetic. They feel stuff in the physical body. There's a vibration, right? Some people smell things. Some people taste things. Some people hear things. Some people just feel it, right? There's an emotional feeling which goes with it. There's a sense of knowing which goes with it, right? So how are you perceiving things? What are you normally looking at? Are you a visual person? Are you a person who learns more through or gets information more through hearing or through smelling or through taste, right? Or through actually just feeling or just getting a sense of knowing. So whichever way that you are accessing information in your normal state of consciousness, that is where you need to tag what is the higher sense perception that you will be working with, right? It will be easier for you to start at that point in time, or I mean in that place.
For example, if I am given a name, first I hear the name, then I search kinesthetically in all directions until I feel a connection being made to that person. From that point, I see pictures and hear information about the person who was named. Several years ago, I could not do that.
So what is it? We just know things, like we perceive things, but we are not really clear about how we are perceiving. So then when we start paying attention to how we are perceiving, the perception will automatically start to get enhanced.
The first high sense I developed was the kinesthetic one. I spent many hours doing body psychotherapy, touching people and their energy fields. Then my discernment moved into seeing. I began seeing things that correlated to what I was feeling. After a lot of practice, I began to hear information. Each of these ways of access can be learned through exercises and meditation. By entering into a calm, quiet state and concentrating on one of your senses, you enhance it. It only takes practice. The hardest part is to learn to enter into a calm state and stay focused on your purpose.
So basically, when we are doing the Vastu workshop also, right? And people now are, some people are in module 3, they'll be going into module 4. So one of the things that we are telling people is that you need to have attended at least 2 of the 5 6-day programs by the Monroe Institute so that you can enhance this extrasensory perception. The Monroe process, I think, is one of the best processes that I know of right now, which allows you to go into a state of no thought, where the mind becomes totally calm and you start becoming focused with clarity on what your purpose is. So she's very clearly stated that the most important thing is to get into a calm state and focus your intent on what you are doing, which the Monroe process does very easily and very, very effectively. That allows us to start sensing stuff, starts perceiving stuff, which then allows us to find the cures to, or the balancing factors which will balance whatever is out of balance also.
Exercises to enhance your perceptions. To enhance your kinesthetic sense, sit in a comfortable meditative position and focus on feeling the inside of your body. Focus on body parts and organs. If it helps, touch the part of your body you are focusing on. If you tend to be visual, you may want to look at the body part. If you tend to be auditory, You may want to listen to your breathing or heartbeat to help you focus.
So basically connecting with the sense that you're most comfortable with.
Now do the same for the space around you. With eyes closed, sit and feel the room you are in. Focus on, reach for, or being towards different locations in the room and different objects. If you need help, open your eyes or touch the objects in the room. Then go back to simply sitting and feeling. Now, have a friend lead you blindfolded into an unfamiliar room. Sit and feel the space kinesthetically, the same way you tuned into your body. What have you learned about the room? Take the blindfold off and check it out. Do the same for people, animals, and plants.
So everything has a frequency of vibration, right? So everything has a different feel. Every color has a different feel. Every taste has a different feel. Every sound has a different feel. You can feel the texture. There is something called synthesia. We've been talking about it, where the senses get crossed. So the person will say, this food tastes like a square rather than tastes salty, right? Or this sound feels salty. So they have a mixing of the senses. So what she's saying over here, to enhance the kinesthetic, feel it, right? And then reach out energetically and then again feel it. That will start enhancing that sensory perception of the kinesthetic sense.
Remember, to enhance your visual sense, sit again for meditation and with eyes closed, look at the inside of your body. If you have trouble doing this, find the sense that will help you. Touch the part or listen to your internal processes until you can get a picture of it. Now do the same for the room. First, with eyes open, examine details in the room. Then, with eyes closed, create a picture of the room in your mind. Now go to an unfamiliar room and start with eyes closed. What can you see?
So again, looking at our body, right? We can actually feel what is happening in our body, where the problem is. So again, enhancing the seeing or the visual perception that we have. So first see what is there, what is the feel of the seeing, right? And then go into an unfamiliar thing and then again see. So you can actually do distant reading and you can do distant feeling of something which is at a distance also when we start getting into these higher sense perceptions. You can look at a person who's not there in front of you. You can look at a space which is not there in front of you, or you're not in that space, and get a sense of what is happening in that particular space. You have to start again. It was not.
Remember, we are speaking of visual perception. This is different from the process of visualization, which is a creative act in which you visualize what you want to create.
Yeah, so now this is very important, right? You can imagine something which is visualization. You can actually feel something which is at a different place. That is not visualizing. That is a felt sense. You're actually feeling it, right? There's a very big difference between the two. People who are doing the Vastu program, this is something very important that we need to understand. We need to get the feel of things, not only the visual aspect of things.
To enhance your auditory sense, sit in meditation, listen to the inside of your body. Again, if you need help with this sense, put your hand on the part you are listening to and feel it or look at it. Then go outside and listen to all the sounds around you. If you do this in the woods, you will begin to hear the synchronicity of the sound. Together, they make a symphony. Listen even more closely. What else can you hear? Sounds that don't exist. Listen more carefully. Someday they may have meaning for you.
So this is something that was very beautifully portrayed in this movie August Rush, where this guy, in all the sounds that were happening around him, he always found synchronicity and a symphony that he used to hear in his head with all the sounds which seemed to be distorted, but that it all, when it came together, created a symphony.
Itzhak Bentov, in his book Stalking the Wild Pendulum, writes of a high-pitched sound that many meditators hear. It is above the normal range of hearing. He was able to measure the frequency of this sound.
So many times, when you're in meditation, you'll hear sounds which are not on the track, right? This happens a lot with this track, which is called the so chord. You'll hear symphonies. Some people hear nature sound. Some people hear all sorts of things when that track is playing. Also, I personally, whenever I'm in meditation or I feel an energy system is coming, I hear a very high pitched chee kind of a sound, which is what he's talking about over here, right? And this many meditators actually hear it, right? That they feel that yes, something is shifting, some kind of a shift is taking place when they hear that sound.
As I developed my seeing abilities, I discovered that the pictures came in two forms. One is symbolic and the other literal. In the case of the symbolic picture, one simply sees an image that has meaning to the person for whom one is reading. For example, one might see a nebula swirling in the sky or a large chocolate cake. In the case of the literal picture, one sees the pictures of events or things. One can witness an experience that the patient had in the past.
So again, symbolism, when we are going into these high sense perceptions, symbolism plays a very important part. So those of you who attended the excursion workshop and the gateway voyage, we constantly talk about this. You're going into that state and you visualize, or something came into your mind, right, from the big guy. What did it symbolize to you? What does it mean to you? So getting out or creating your own language when we go into these higher states of perception becomes very, very important.
In both the symbolic vision and the reading of an event, the healer takes the position of witness. That is, the healer enters into that time frame and witnesses events as they occurred. The same is true for the symbolic vision. The healer watches the vision unfold and describes it as it is unfolding. I call this receptive channeling. It is very important that the vision not be interpreted or disturbed by the healer as it unfolds. The meaning the vision has may be different for the healer and the patient.
So again, many times when you're going into high sense perception, you'll see you can see it as a video going, right? As a movie going in front of you. Now, it's very important that you just tell it to the patient as it is, right? What does it mean to the patient becomes very, very important. Yes, interpretation can be there, but that will be, colored by the life experience of the healer, which is something that you don't want to color. You need to allow the patient to be able to interpret for himself or herself.
The meaning the vision has may be different for the healer and the patient. For example, if you see a symbolic picture, say of a scene of a blue car driving down the road, you don't immediately say, "Oh, what does that mean?" You just watch the car drive down the road and let the scene unfold before you. In this process, you will gather information piece by piece and will slowly build an understandable picture. You may not know if the picture has symbolic meaning or if it is literal. That is, something that actually happened or may happen until later. This type of information receiving takes a lot of faith. You may take as long as a half to 1 hour to build that picture into something that is understandable. On the other hand, some readers use their own symbols and give readings by interpreting them. This works only with a lot of practice because the reader must first build a clear set of symbols through which she can receive information.
Right. So this becomes important, right? The symbolism in a reading becomes important. And when a reader has been reading for a long time, they can start making correlation that, okay, every time that this symbol turns up, it means this. Every time this symbol turns up, it means this. So they can give an interpretation to the client or to the patient, but it doesn't mean that it is the thing that will work for the patient. Ultimately, the best thing that you can do is to enhance the capability of the patient or the client to read into their own symbolism, which is again very important. And that is what the focus of awareness is all about, that to allow the person to get enhanced enough, to become aware enough so that they can read their own symbolism.
In another type of literal seeing, the healer sees a picture of an internal organ of the patient. The picture either appears on a screen in the healer's mind, which I call the mind screen, or appears to be located inside the patient's body, as if the healer can see through the layers of the body and into the organ like an X-ray machine. This type of seeing I have labeled internal vision. It is a very powerful tool to help describe an illness. With internal vision, you use active direct access. This means you go after some specific information you wish to access. For example, by using internal viewing, I can look wherever in the body I wish to. I can decide where to look, at what depth, at what level of the aura, and in what resolution or size, macro to microscopic.
Okay, now this kind of vision is naturally developed by lot of practice. Okay, and the more you use the process, the more accurate and effective you will be at getting information. We can actually do a test of all the organs, where the imbalance lies in which organ, just by using the Lecker antenna, right? So we have a full body diagnosis by using the antenna, and of course using the aura photography, and people can actually start to sense it also. Right, I think we'll stop here.